And it said that in the Philippines, around 18% of students aged 13 to 15-year-old said that they had attempted suicide at least once in the past 12 months. And that really blew my mind.
The worse I'm doing in the beginning of the program, the more useful the program will be to me.
It's really starting with something small and then building it up as you understand the problem and the possible solutions more.
I'll make it as a coach, light the spark inside, empower every soul to turn the tide. I'll make it as a coach, help others grow, changing lives with every story I know.
Welcome to the Making of a Coach. I'm Toby from Metafolks, and today I'm sort of breaking the rules of podcasting by diverting from our regular focus of hearing the stories of experienced coaches. Instead, we go to the intersection of mental health, doing good, and building organizations, because I'm sure these are all topics that both I and also you as a coach or facilitator are super excited and passionate about. We go to the Philippines in Southeast Asia, a country with 7,600 islands and 112,000 people. And unfortunately, also a country with a very low supply of mental health practitioners, and a country that has grown very close to my heart over the last years, because at Metafolks we've been collaborating with Filipinos already since 2020 in the design and the delivery and all the things that go around our coaching cards. As we've come closer and closer, we also partnered with a NGO called Flourish. They deliver mental health interventions to teenagers, and I've been super fascinated by their approach of building an organization and delivering their service. It's very much focused on evidence and really having an impact. So today I invited the two founders to talk not about coaching and building a business, but about designing a program to remove stigma from mental health and to help young people to flourish. So let's hear from the founders, Roch and Shen.
Flourish is a mental health nonprofit in the Philippines, which the premise of Flourish is that we believe every Filipino deserves to flourish in life. And we think that poor mental health is a barrier to that. And so we want to test and scale cost-effective and evidence-based mental health solutions so that they become accessible.
And maybe one cool thing that is not obvious to the listener right now, when I say flourish, that is, of course, on the one hand, the verb flourish with F, but
Yeah.
for the name of your charity or for your NGO, you put a PH in front of it.
Yeah.
So it's flourish with PH, like the Philippines. That's where you are based as well, right?
Yes.
I guess I would also add that right now, even if our goal is to test and scale cost-effective interventions, we're focusing on the younger population, so on adolescents, and we're reaching them through various partners such as government offices, other non-government organizations, and we're focusing on guided help at the moment. And to give a background on myself, before I co-founded Flourish, I also helped co-found another mental health charity in India called Kaya Guides. So they also focus on the youth but provide digital guided help. I also led a mental health research project, which is about the top mental health charity ideas that can be started in the Philippines. And that's really how Rob and I started collaborating.
Thanks. Would you also like to briefly share how you got to work on Flourish, Roch?
Yeah. Well, I've been in the nonprofit space for most of my career, but mostly I was actually in climate change. And it was in early 2022 when I really started seriously thinking about working in the space. I have had the idea of working in the mental health space, I think as early as 2015, although it was more in the space of flourishing and having agency, learning more about how to regulate, understand ourselves, and, that space. And in 2020, I actually stumbled a study. It was a report. So it was the Global Health School Survey. And It's said that in the Philippines, students age 13 to 15-year-old, around 18% of them said that they had attempted suicide at least once in the past 12 months. And that really blew my mind. And while I was still working in climate change, it felt it was an urgent problem. And I felt called, and I felt like, okay, this is the time that probably that idea I had in the past of helping young people learn all these skills, life skills, and emotion regulation. Maybe it's about time that I started working. And Shen happened to be researching as well. And from conversations, it became, more concrete ideas until, we felt like it's it's time to started working on it.
Thanks. Yeah. So Shen was already looking into the space of mental health interventions and how can that be scaled. And you came in from as basically a nonprofit veteran, coming originally from another sector, but then bringing in all that experience. Can you take us a bit into the work on the ground?
So our first program, Guided Self-Help, works by providing the participants with a physical workbook. So we deliver this workbook through an orientation. So it's an important part of the program. So the first interaction that we have with the students are the orientation, where we talk to them about what they can expect from the program. But aside from the program, we also introduce to them some basic mental health concepts. So they attend this orientation with their parents. And it's important for us to them properly about what they're getting into, also increasing the awareness of both the participants and their parents through these orientations. And after the orientation, if they're still interested, they sign up for the program, and a week after, they sign for the program, receive the toolkit, and then a week after, the weekly check-ins with our lay mental health mentors start. So they meet with these mentors for every week for 8 weeks.
So most of our audience, they come from the global north. We have many Germans, Europeans, also people from the UK and Americans listening in. Can you share a bit the reality of your target group? How does their daily life in the Philippines look like?
I think the mental health burden, not just in the Philippines or in the global south, is that there's there is high burden, but there is very low available resources to them. So the budget spent on mental health from the government doesn't even reach 2% of the overall government spending on health. And we only have like 1/3 of the global average of mental health workers attending to the same number of the population. So in the Philippines, for example, there are only 28 children and adolescent psychiatrists in the country. And we have like 30 million young children. So it's crazy just comparing those numbers. And there's just like 357 other mental health workers, aside, including psychiatrists. So it's just so hard to comprehend how these people are able to address the needs that of the population that they serve.
I mentioned earlier the 18% suicide rate among 13 to 15-year-old that urged me to work on this. But more recent data, which is 2019, show that it has grown to almost 25%, almost one-fourth of them saying that they had attempted at least once. Yeah, but also on the reality, because we did do focus group discussions with adolescents, with parents, and of course from our work. And the adolescents that we work with are really coming from low resource areas. So we have users coming from really remote islands, and which is why also it was very intentional for us to deliver the service via a printed toolkit instead of a tech-based service. I think for most of our users, they share the mobile phones with their parents, or most families are actually sharing a phone across the members. We do have users who are still struggling with internet connection, even with mobile connection, that they would have some issues with calling our mentors because of data and signal network issues. And even the parents are somewhat struggling. And many of the problems we learned were related to relationship, but at the same time also to their condition, poverty, not having the resources they need for school and stuff like that. So, yeah, it's really quite complex because it's not just physical and mental, it's really psychosocial and the conditions. But yeah, we do work with adolescents from low resource areas and have very different realities, perhaps, from what's familiar to the podcast listeners.
Yeah, so we have a country which is large in terms of population. It's really spread out to many remote islands. And then you're saying there's many adolescents. There's a very low supply of mental health workers. So access to these kinds of interventions is not great. How did you then come to decide on exactly this target group and this type of intervention?
For the adolescents, it's really just the data showing the prevalence of the problem in this population, in this segment. But at the same time, also considering that about half of mental health conditions start around this age, adolescent, and it's a very critical period where there's a lot of changes and development happening in a person's life. And we thought it's kind of like the sweet spot to have this kind of intervention. Well, Shen did the research. So probably Shen would be the best person to talk about why it was the thing that we decided to test.
When it comes to this age group, in terms of mental health, it's also one of the most neglected populations in terms of research. So there's not a lot of things we know about this population. Like there's still a lot of mixed thoughts about the type of interventions for them. And I think it's really not easy to work with this population, like compared to working with adults, because you have to go through parties who have access to the population because they don't have the freedom that adults already have when it comes to accessing mental health services. So that is also one of the importance of working with this age group. And when it comes to choosing this specific intervention, we of course look at the evidence base for this. So guided health up is considered one of the most effective mental health interventions. So that's from our research, but it's also from other meta-analysis done. And then we also thought about acceptability, of course, whether they really do want this. And workbooks are familiar formats to adolescents because they encounter it in their daily lives. So that was part of why it's also easy to scale.
Yeah. I can really hear that you have a very scientific approach, like even your language, it's a lot getting the numbers right and using terms like scaling. And I'd love to unpack that a bit more in detail in a bit. Before that, however, let's actually make that more plastic. And maybe we can even look at the life of one user. Let's say we have John, he's 14, he's living in a remote island. And you said, okay, you chose a workbook for them to do this psychoeducation because maybe John's smartphone doesn't really exist. In fact, he's sharing his smartphone with his parents, and there's more like this family smartphone. And so that's why obviously he wouldn't want to write down very personal thoughts. So let's go a bit into the life of John and your intervention. Where does he get in touch with Flourish, firstly?
So, like I mentioned earlier, the first thing we do in preparation for the program is reach out to partners. So, our partners have some form of access to the age group that we intend this intervention for. So, examples for this are youth organizations who have services for children and adolescents. So, John is most likely already accessing some other type of service from this partner organization. So we talk and prepare the program for them, and then the partners go around their community to ask John and other 7th age group to sign up for the program. And then after a period of sign-ups, we meet John and the other adolescents who signed up through the orientation.
Let's say I'm a fly on the wall of this orientation. What would I see?
So in the orientation, a group of 12 to 18 years old sitting down and then facing presentation. They will be sitting with their parents And then we'll pass around some forms after giving them a few times to answer that, which is very important because they're minors and we can't work with them without their parents' consent. That's when we introduce the program to them. So we usually start with a sensing of what they know about mental health. The answers that we usually get, and this is where stigma is still also apparent, is that they all usually refer to it as in the form of illnesses. It's nice that they're familiar with terms like depression and anxiety and stress, but that's what they automatically think about when they hear the word mental health. And then there's also those who really don't know anything about it. And that's goes the same with parents.
So basically, the orientation helps John to understand what is depression, what is anxiety, these kinds of things. You want to normalize talking about this with others, with their parents. And then you said there is also this aspect of educating the parents, how they can actually talk to John about this. And I was wondering, do you talk to parents with the adolescents present and vice versa, or do you work with groups there?
The first part of the orientation, which is like more general about the program and about mental health, everybody's there. And then we separate the parents while the adolescents are doing the pretest. Many of our orientations also happen in a basketball court, which is, a typical venue for gathering people in the Philippines. So it's pretty spacious. So we move the adolescents to one side and the parents to the other side. So there's a little bit of privacy and parents can start asking questions, giving comments. I forgot to mention, we also inform them about important signs. If they observe it in their children, that these are signs that the child might be needing help and they could go to the health center or go to a hospital, try to check with the doctor, or if our partner is the health office, they can reach out to them.
Can you give an example for one or two of these important signs that I can see as a parent?
Yes. So if there's prolonged low energy and not having the motivation or enjoyment in the things that the kid has been enjoying, but they've observed that for at least 2 weeks, they haven't engaged with that same activity, haven't had the interest, then that could be a sign. Another is if that they are neglecting themselves, just basic hygiene, not being able to do the basic stuff, and it's affecting their performance at school, it's affecting other activities. If the kid is, it's pretty normal for adolescents to isolate. It's a period when, that typically happens. But if they're finding clear changes in their behavior, then that's another sign.
So if I see my child is losing interest into something that they previously were interested in, and there's like this lack of drive. So I would say that's probably similar depressive symptoms that also an adult would have, actually.
Yes. Yeah.
Yeah. Let's go back to John and into the orientation. Shen, you were already telling us a bit about it. After the orientation, John goes home and then receives a simple WhatsApp, I assume, from their mentor and goes through the program over the following weeks, which means they basically work with the workbook, read things about it, can write into it. What else is happening throughout the course of the program?
So they do have assigned worksheets. That's what is ideally they've done when they meet with the mentor. But during the first week that they meet with the mentor, they talk about their goals and commitments for the program. And so that the mentor also has more idea about how to provide support to John.
Can you tell us a bit more about the contents of the workbook and the chapters? How does the workbook help structure the entire program?
Yeah, so the workbook provides them the information. That's the first part. And then we have the second part, which is the worksheets where they get to practice the techniques that were mentioned in the chapter. And there's also space for reflection where they can just write down any thoughts that they have about what they learned.
I guess I can share more about the actual content. So earlier, Shen mentioned the modules. So we do have 5 in the toolkit. First is fighting stigma. So it's general information about mental health, healthy habits, and building self compassion. The third module is on emotion regulation. So it has more skills and techniques that they can use. The fourth one is building healthy relationships. And the last chapter is around help seeking.
So it also has a build up, if you've noticed. For example, we introduce the healthy relationships first before help seeking because the support system is important when it comes to help seeking.
And based on those takeaways, what kinds of, again, experience or model that could deliver the knowledge, which is why we have in the toolkit the information, kind of introduction part. And then there's the experience of trying something, which is really the worksheets, really prompting them to try something and, have an experience. There's the level up, which is trying to giving them tips and sort of challenge to build on these things that they are learning and integrate it in their routines, trying to build a habit out of them, and of course the reflections part as well. And we had several back and forth. So we would have a first and then again have conversations with adolescents, have them look at the content, give suggestions, and we kept trying to test and iterate before really coming up with the design. And of course, we had help from MetaFox nonetheless for the design, for actually putting together all the ideas and putting it in this format that's our users are finding to be attractive and appropriate for them.
So what I hear is, on the one hand, we have making sure the content is accurate and science-based from a psychology perspective. Then there's making sure that you speak the language of the youth, so it can really be adopted by them. And then it's also about the design, using the MetaFox designers who usually spend their days designing coaching cards, actually making this look good. So it's also fun to interact because you also want people to interact with. It's not only something to read, it's really worksheets where I reflect, where I write down my challenges, things that I'm grateful for, etc.
Yes. And of course, we also had experts check the toolkit before we started distributing them. And even with the design, we at some point present the different looks or kind of design for testing, and they would suggest which ones they feel like is more appropriate for them.
The other building block that you mentioned now a couple of times, but I would like to look at it a bit more closely, and that is the lay mental health workers, Shen called it earlier. What does that mean? Who is a lay mental health worker and why do you need them?
I can start. Well, one problem that we mentioned is there's really a lack of mental health and health practitioners in the Philippines. And it's a gap that we also wanted to fill. But of course, there's literature around effectiveness of training lay health people to provide some level of support. And so our lay health mentors are individuals. They don't have to be psychologists or psychiatrists. We select them in terms of their fit for the role, which is being able to relate to adolescents. So we want them to be like, we have a concept here of ate kuya, big sister, big brother. So it's more of that and not, super adult mentor. So that relationship could be more, there could be more rapport with our users. We have developed a training process as well for our mentors.
So through these lay mental health workers, you also overcome the challenge that we talked about previously that you have in the Philippines and I guess in many countries across the global south and even beyond. And that is a lack of psychologists, of access to mental health treatments and interventions in general. And that's why you said, okay, we need to actually bring in people who do this voluntarily. Is that right?
Yes.
Yeah. So we need to bring in volunteers who actually take on this role. And through having the toolkit, the workbook, they can also do that basically because they have this blueprint to follow along. How else do you train them to take on this role?
So the training is in the form of online sessions. It's a mix of synchronous online sessions and asynchronous course materials. And then during the program, they also have supervision from the team. So they have the option to meet one on one with our mentor supervisor if they have any concerns or if they need any guidance. And then we also hold general mentor check-in. So this is the group check-in with mentors where they can share their experiences, talk about reminders for the rest of the program.
We also have a manual for our mentors, so they can have it while they are doing the mentoring and a regular check-in with their team.
So next to the workbook for the program participants, there is also sort of a cheat sheet for the mentors.
Yes.
Yeah.
So I think what becomes quite apparent if one is listening to you, and what also fascinated me about Flourish right in the beginning, is this: you approach this like a startup of some sorts. You started with focus groups. I remember from being part of the workbook development that we had a first draft, then we tested that, then there was a second draft that we produced. And so you seem to be not just a regular association or NGO that is sort of, we feel like this is a good thing that the world needs, so let's do it. You take a very scientific, almost business-driven approach to this entire venture. Can you talk a bit more about the principles that guide you in setting up and scaling Flourish?
Actually, Shen and Joseph, our other co-founder, we actually met through a local chapter of Effective Altruism. It's a movement that basically promotes rationality, evidence, paired with wanting to do good. Even when we started working on mental health, we have this framework of scale and neglectedness. Looking at the scale of the problem, neglectedness, meaning if we put more resources in this problem, it could have greater marginal impact. And also tractability, meaning that if we actually work on this problem, there's a chance it being solved. And we try to have that always as kind of like a guiding principle in our decision making. And as a practice, also, whenever we make decisions, we try to be clear with what criteria we are setting and having sort of metrics or kind of weighted factor model in some of our decisions to help us really make informed and evidence-based decisions.
So there's these principles of the effective altruism movement, and all that you do is evidence-based. You want to focus on the big problem, and you also want to focus on the problem that is neglected, meaning there's not many organizations actually working on that.
Yes.
Yeah, talking a lot about impact, I was wondering, how do you actually measure impact?
So for us, we look at various mental health outcomes, specifically life satisfaction, and depression symptoms, and protective factors that are aligned with the toolkit lessons that we mentioned earlier. So there's mental health literacy, likelihood of help seeking, and contentment with relationships, for example. We assess our impact by comparing their pre-test and post-test scores and understanding our cost. So we also want to make sure that it's cost effective, making the most use of the resources that we have.
Mm-hmm. So, for example, there's a section about help seeking in the workbook and in the program. And then you asked a question like, how often did you talk about your state of mind with your friends? And you asked that in the beginning of the program and in the end of the program. How can I imagine that?
For help seeking, it asks how likely you are to ask help from people when you're having a personal or emotional problem and when you're experiencing suicidal thoughts. So those are two different questions. Other questions are rating statements. So I'm comfortable talking about mental health. I have people in my life to talk to about things that matter to me. I am confident in my ability to manage strong emotions.
So it is asking questions from the subjective perspective of the program participants. You also mentioned
Yes.
well-being or happiness. How do you measure happiness?
So we're measuring life satisfaction. So it's seeing the satisfaction with life scale, SWLS, and it's composed of 5 items. So the items consist of general statements that they either disagree or agree with. And some items that I can remember are simply I am satisfied with life, or if I could go back in time, I would change nothing in my life, or the conditions of my life are excellent.
So asking, am I content with my life? Do I have any regrets, etc.? And what did you measure so far?
So during our pilot and also some initial evaluations for the programs that we ran during the first half of the year, we did see significant improvements in life satisfaction among our users, and this is more apparent with those who started with lower scores in life satisfaction. Recently, we also started measuring depression symptoms using the patient health questionnaire, 4 item patient health questionnaire. And we're also seeing that trend where users who have higher scores in anxiety and depression have reduced symptoms in anxiety and depression at the end of the program.
So the worse I'm doing in the beginning of the program, the more useful the program will be to me.
Yeah. Although just a caveat that we're finding that the biggest impact outcome comes from those that start from slightly dissatisfied, not the extremely dissatisfied ones.
Thanks. Let's look a bit at the aspects of building the organization. And there I'm wondering, how is Flourish funded?
Yep. We are funded through grants. Yeah, we've applied for grants from mental health funding circle. We do have a grant from the Dory Foundation, mostly from those sources currently.
And how did you acquire this?
It's really through application. I remember when we were starting Flourish, we actually got rejected. We started trying to raise fund while we're still understanding and developing, just continuing the work, even if we weren't funded yet at the time, until we had some traction that increased the confidence of the funders to support our work. And we're able to get renewal of funding from them.
So very practically, that meant applying for grants, writing long documents where you answer questions that are asked, or how did that application process look like?
Yeah.
What was difficult and what did you learn?
Well, to be fair, the Mental Health Funding Circle has a very straightforward, simple application process. It's a couple of questions, and then you attach a one-page document that captures, the work of your organization. And if they're interested, you get a call with the funders. Because it's a network, it's really different funders trying to contribute. If there are some who are interested in your work, you get to have conversations with them. They ask follow-up questions, you send more stuff. So at least the investment in the beginning is not too much, but you just add a little bit more as you progress in the process. But I would say it was a simple, straightforward, easy process for us.
How do you build trust with these kinds of donors and partners?
Yeah, well, it's definitely very important to build trust. I think that even if we didn't get funded in the beginning, we were just doing it on the side because we had our full-time work. And this is a thing that we were really passionate and we're trying to build from the ground with the resources that we had ourselves. So I think after the rejection and continuing the work and having traction and progress in the work built the trust that we're serious about this. And of course, once you have that relationship, it's important to continue nurturing, which means we regularly send updates. Of course, there's required reporting, which for the network is, again, pretty doable. But at the same time, just having another layer of relationship with the funders where even outside of those reporting schedules, we still provide them updates, especially if there are exciting milestones. But at the same time, communicating openly our challenges and our difficulties, the things that we still need to figure out. That level of transparency build trust because The reality is when you start working on it, even how great you're planning and how much you've thought about it, something still is different. Is going to be when you're really implementing. So being honest
Mm.
about those things as well.
Yeah. And I think you are also very transparent with all these numbers that we talked about previously. I remember seeing this Google Data Studio, like a business intelligence dashboard, where basically I, as a partner, can really see the quantitative answers that people give to their surveys that they take throughout the program. What I also notice in your answers is that it doesn't sound like network played a big role, and that may be encouraging for early stage NGO founders and social entrepreneurs. It really seems like it was more the craft of being able to write a good funding proposal more than knowing important people. Is that right? Or what would you say? What role did your network play?
I would say network is very important. It's just that I guess when we were starting Flourish, it's more of, I guess, me personally just not having that network yet at the time. But at the same time, we know of mental health funding circle because of our network, because of the effective altruism network, and some of them are aligned, and that's how we learn about them. And now I am seeing more and more the importance of network and building trust with people that could even expand that network.
Let's say I'm a founder of an early stage NGO, and I'd like to learn more about this whole effective altruism thing and the networks you are in that also bring you traveling around the world. Where would you say is a good place to start and to engage there?
I guess I can answer for the effective altruism. There's a lot of resources online, and it's easy to find opportunities to engage. So there are some fellowships and there are local networks, there's events happening in different regions, in different countries. I guess for most of your listeners, it's possible that they could find local chapters. That's how they can start engaging with effective altruism. But at the same time, in terms of building network in specific areas like mental health, it's really engaging with the space as well, participating in events, attending conferences.
For me, I think I'd return to the agile and iterative approach. So we did start this, like Rock mentioned, the initial applications were rejected, but still continued working on this. And we work on this while having other full time jobs. So it doesn't really have to start from something perfectly established already. It's really starting with something small and then building it up as you understand the problem and the possible solutions more.
So build, measure, fail, possibly learn, and keep building in a way. To slowly approach the end of our nice session here, let's say I've now listened to the three of us talking, and now I'm super interested to engage, to learn more. How could I get involved with Flourish?
One way is to our site, it's flourish.ph, and flourish with the ph .ph. They can also reach out to us on LinkedIn. We'd be happy to connect and explore, how we can collaborate.
And how could that look like concretely, especially if I'm not based in the Philippines?
We have plans to open an internship, but there's nothing concrete yet. But it will definitely be an involvement in our monitoring and evaluation, our administrative and operational processes, and on the ground program implementation.
We would be interested working with researchers or institutions who want to work with us further into our impact or the effectiveness of the work that we do. Of course, for those with resources who would want to contribute, we'd be happy to accept that. Exploring partnerships, exploring work elsewhere that we could also test here, that would also be something we'd be happy to explore.
So what I hear is NGOs in a similar field, researchers who want to get involved, money is always welcome. And
Yep.
what about if I'm a trainer or a coach and all of this sounds super exciting to me? how could I contribute there?
Well, we would definitely be happy to welcome experienced coaches, mental health practitioners to review our work, see what improvements we can make, perhaps more experienced practitioners, if they'd be willing to help lead our lay health mentors, provide mentoring to them to further improve the work that they do. I think that would be an opportunity.
Thanks so much. This is it from Phlourish. And as you could hear Shen and Rock talking about users and scale, could really sense how driven they are by evidence and by iterative improvement, an approach that I usually come across more in startups than in volunteering organizations. And at the same time, they are, of course, also super committed to bringing these principles to the mental health space. And this combination really made me a big fan from day one. If you want to learn more about their approach or get in touch, you can go to flourish.ph. And in the show notes, we'll also link the LinkedIn profiles of both Shen and Rock so you can easily reach out directly. I'm also linking the books and resources that Shen and Rock mentioned, as well as the Happier Lives Institute, a research center that's also working on these themes on a more systemic level, who really have shaped my view when it comes to doing good better in the mental health space. That's it for today. I hope you enjoyed this small non-profit special, and we'll be back in 2 weeks with unpacking coaching practice and business building with the making of a coach. I'm Toby from Fox. All the best and bye-bye.